Hey everybody, we've made a number of these videos. It's Dr. Gunn-Nolan, the Chief Medical Officer for Sova Health. Today we have a special opportunity to discuss some issues and some blatantly wrong information that's been out there, and just to make sure we're clarifying all these concerns around COVID-19 and vaccines. Although this video is going to focus on fertility and our concerns for obstetrics and things like that related to the vaccine, I do want everybody to know if you have further questions about the COVID-19 vaccine or questions that you want answered through these videos, please email us at sova@lpnt.net.
Hello, I'm Dr. Honea. I'm a OBGYN at OB-GYN Associates here in Danville, and I just wanted to run through some common questions that I'm getting from patients both in the office and having people ask online. I'm definitely getting a lot of questions from people who are interested and concerned about everything they're reading about both fertility, pregnancy, and breastfeeding. And so there are a lot of reasonable concerns about this, but most of them are not founded on science, and what we're seeing from the evidence is very reassuring. So in July, some of the guidelines changed, and ACOG, or American College of Obstetrics and Gynecology, changed the recommendations that everyone who's breastfeeding, pregnant, or trying to get pregnant should go ahead and get the vaccine. And that's new from before when the vaccines first came out. So I'm recommending it to all of my patients, and my own wife during her recent pregnancy actually got the vaccine herself. So some of the questions that I get, the first one often is it safe to take and will it hurt my baby? And everything we've seen so far is that COVID vaccines are safe in pregnancy. We haven't seen any specific harm to moms or their babies. The side effects are the same whether you're pregnant or not. And then there's also no evidence of any harm at all to the babies as they carry throughout pregnancy. So the guidelines, like I said, right now is that everyone in pregnancy, breastfeeding, or trying to get pregnant get the vaccine. The other benefit that we're seeing to getting the vaccine in pregnancy is the antibodies. So for years we've been telling women to get the flu shot and the Tdap shot during pregnancy because the baby doesn't get the vaccine, but the baby gets the antibodies from the vaccine. And that means when the baby's born with protection from those viruses. And we're seeing the same thing with COVID. They've done tests where they've actually tested babies for the antibodies against COVID, and they are positive. So that's a good sign that the vaccine itself isn't going to the baby when you get it when you're pregnant, but the antibodies from the vaccine are actually helping your baby be born with some protection. So in my family, since my wife got the vaccine during her pregnancy, our baby girl is born with antibodies to protect her, and so she has more protection for her older brothers who they're not old enough to get the vaccine. So she actually carries a little bit more than them, and so that's a big reason why I tell people in pregnancy to go ahead and get it, just to protect your baby if for no other reason. And then following that track, the next line that I get a lot is, what about for breastfeeding? Because I definitely have had patients that were very nervous about getting the vaccine during pregnancy, and they decided to wait and then are thinking about getting it while they're breastfeeding. And we see the same thing as in pregnancy, whereas the vaccine itself isn't going through the breast milk, but the antibodies from your body's response to the vaccine, those are going through the breast milk, and in theory should give your baby some protection against COVID, even since the baby's too young to get the vaccine itself. The other concern with that, as I mentioned in both of those last two questions, is that the vaccine's not going to the baby, and there have actually been some studies that have looked at where the vaccine travels, and the study showed that the vaccine usually stays in the muscle or very close to the area where it's injected, and it's the antibodies that go everywhere else. And so that gives us a lot of reassurance as OB-GYNs telling our patients what to do, that we're much less worried about theoretical problems with the baby getting the vaccine. The other concern, and I don't know if this was addressed in other videos, is with can the vaccine affect my DNA? And that's something that concerns mom as they're thinking about a growing baby within them. But the good thing about specifically the Moderna and the Pfizer vaccines with messenger RNA is that RNA just goes into the cell but not into the nucleus, and so there's no way for it to get to the part of your cell where the DNA is, and so there's no way that it should lead to any change in DNA for you or for your baby. Another question I commonly get is, does the COVID vaccine cause infertility? And this rumor was started based on an article from two European doctors, a pulmonologist and a research physician. And it was started because they were concerned about a protein that's in the placenta, and could the COVID vaccine affect that protein and lead to infertility. And there have been some studies done since then that actually compared the protein that we see in the placenta that they were concerned about to the COVID vaccine, as well as the spike protein that the COVID vaccine makes. And what we find is those are not similar enough to affect each other. The COVID vaccine has also been out long enough now that we are seeing women who receive the vaccine and are getting pregnant and carrying pregnancies since getting the vaccine, and those are both very reassuring. The other thing that reassures me is knowing that some of the fertility specialist organizations actually are recommending the COVID vaccine even if you're in the middle of fertility treatments. So the American Society of Reproductive Medicine actually has an article out that anyone can access that goes through where the rumor started with the concerns about the protein in the placenta and the vaccine potentially affecting it. And they actually go into more detail than I'm giving here about that and how it's actually not true, and that women who want to get pregnant in the future should still get the vaccine for the protection of themselves and their future pregnancy.
Dr. Honea, I just want to take this moment to say thank you for sharing this information. Again, I know there's so many questions out there, and on social media these days, so much information gets shared and it's wrong. And at this point, what we're seeing with COVID is wrong information is actually quite dangerous. So we hope that this helps to clarify a lot of this information that's been circulating. But surely if you have any other questions, please just email us at sova@lpnt.net. Thank you.
Thank you.